Welcome back to another Senior Learning Institute's educational moment, where older adults and their loved ones turn for honest and straightforward information. In just a few minutes, you'll enjoy bite-sized, easily digestible nuggets of knowledge, empowering you to make the right decision the first time. So without further ado, here's our founder, certified senior advisor, seniors real estate specialist, nationally syndicated podcaster and speaker, the advocate you can trust, Mr. Ted Gottlieb.
Hello, I'm Ted Gottlieb, the founder of the Senior Learning Institute. Welcome back to another educational moment. What I know about medications and drug interactions can fit on the top of a pin. What I do know is that for a lot of us, as we age, we take more medicine. I've read that about a third of older adults take 5 or more different prescription drugs. Don't know if that's true, but I'm sure our guest will clarify that. The question, though, does become, is the cocktail that we're ingesting hurting, helping, or otherwise doing nothing at all? Heck if I know, but I'm betting that Hedva Barenholtz Levy does. Hedva, tell us about yourself.
Hey, Ted. Well, I'm a pharmacist who specializes in senior care. I work with older adults who live in the community and their adult children, and my focus is identifying and preventing medication-related problems, which are all too numerous in patients as we get older and take more and more medications, as you mentioned. And that statistic, it's 39% of older adults take 5 or more medications regularly.
So 39% of older adults are taking 5 or more medications.
Yeah, and the number's only increasing. The trends in the last 5 years have shown a sharp increase, and with all the available drugs, you see it on the pharmacy shelves and with prescribed medications, the drug advertisements. There's a lot of medications being prescribed these days.
Wow. So then let me ask you this, because many of us take the medicine that we're prescribed and we ask no questions. You know, drug interactions may be the furthest thing from our minds. Why should we be so concerned?
Because drug interactions are so common, and because we don't always think about adding medications and leading to drug interactions. But the fact of it is that drugs interacting can lead to adverse drug reactions, which can impact quality of life and actually adversely affect the control of our disease state and our health. So we have unexpected doctor visits. We might have added prescriptions due to a drug interaction. We may have a disease state that is no longer controlled because of interacting medications. And I think another major concern is because we have so many drugs available without a prescription, that people might be adding medications to their regimen that the doctor or the pharmacist is not aware of. And that can lead to further risk of drug interactions.
Right. So what are some of the more common drug interactions?
Where to start? When I want to preface this by saying when I'm asked to speak to groups, when I sit down with an individual, oftentimes I will get that question about interactions. Are these medications mixing okay in my stomach? They worry about things like that. And the answer is it's so individual of course, what drugs are interacting for a particular person. But there are common types of medications that are known to have drug interaction potential. And I would highlight some among them prescribed medications, drugs like warfarin or Coumadin. It's a common blood thinner that has a lot of drug interactions. Amiodarone is an important heart medication that has a lot of interactions. But then there's medications like our statin drugs for cholesterol, for high cholesterol. The statin medications have, in general, interactions. But what is interesting when we talk about interactions and get into thinking what really is important, within the class of statin drugs, for example, using a cholesterol drug class, as an example, some of the medications of the statin drugs, like simvastatin or lovastatin, have a lot of drug interactions, but other drugs like pravastatin or atorvastatin have fewer drug interactions. So I as listeners think about these medications, and if I mention specific names, I want the listener to be very careful to check with their physician or pharmacist to know if their particular medications are interacting. We think also about some of the antidepressants, the SSRI antidepressants that are drugs like Zoloft and Paxil. We worry about drug interactions with those types of medications.
And just to clarify, by interactions, we're talking about how one medication, when it mixes with another medication?
Thank you for stopping me on that, Ted. And just to highlight, yeah, what is a drug interaction? It's a drug that reacts with another drug that can either cause an increase or a decrease in the effectiveness of that other drug. Just if that makes sense. So where I mentioned a statin drug, simvastatin might be taken with warfarin, it can increase the risk of bleeding with warfarin, so it increased the effects of warfarin. In another situation, a drug might diminish the effectiveness of the drug, so it doesn't work as well, if that makes sense.
Yeah, it
right?
does. So
Now,
let me ask you this, and so don't most pharmacies have a fail-safe system in place that might point to potential issues when combining medications?
so there are drug interaction programs that are fit into with our information technology. There are absolutely drug interaction screening programs that are available or that all the pharmacies use. And there are a couple issues with that. One, there are a lot of interactions that can be programmed, from minor interactions, which mean there's no clinical significance. The drugs might affect each other, but it's not going to matter to the person clinically. It won't affect them by way of side effects, or, as I mentioned, affect the way their disease state is controlled. But there are also the major interactions. So a pharmacist has to be careful to pay attention to the important drug interactions when an alert pops up in the on the interaction screen, and ignore the ones that are less important or not important. So yes, there is the screening that goes on in pharmacies, but there is the human factor of recognizing and catching those that are important. I also want to interject here the issue of drugs that may not be on the pharmacist profile, right? So think about patients who go to different pharmacies. And I already mentioned the non-prescription medication use. So if someone is taking a sleep medication or medicine to help them sleep, or something for their stomach symptoms or what have you, or an antacid, those drugs the pharmacist would not be able to screen for on the interaction program, right? When they're dispensing a medicine, if those non-prescription drugs are not included. Also, sometimes patients get drug samples from doctors, right? So things that may not be in the pharmacy profile.
So it sounds like a lot of this is on us as the patient and the consumer to make sure that the professionals that we're using, our physicians and our pharmacists, are aware of everything that we're ingesting, including vitamins?
Absolutely. So yeah, when we talk about what we can do to help ourselves avoid some of these problems, it really comes down to the consumer, the user of the medications, to really speak up for themselves and ask about drug interactions and have that complete list, right? Make sure that all prescription medicines, non-prescription drugs, dietary supplements as well, right? A lot of us are taking glucosamine or garlic or ginkgo, for example. Those dietary supplements can interact with medications and need to be on a drug list for sure.
What's the added value, for instance, in working with someone like you versus depending on the physician or the pharmacy?
For my service, I go into the person's home typically, and I do a very thorough review. And like we just talked about, looking at the non-prescription drugs and the dietary supplements, and am able to thoroughly screen the medications for possible drug interactions. But then I also am able to look at the patient's disease state and how they react to medications in order to identify drug disease interactions. And like I said, if the physician is not aware of some of these non-prescription medicines, someone with diabetes might be taking a medication that has sugar content and isn't realizing that's impacting their blood sugar control. Or I met with a patient who took a potassium supplement but was also taking an ACE inhibitor, and that's a potentially dangerous interaction. but it was only by me talking with a person and him showing me all the supplements that he was taking that I was able to find that interaction.
Right. So how often are you interacting with the physician or with the pharmacist once you do, once you're involved in a case?
Well, my report goes to the patient and then right back onto the physician, especially if there's an important interaction. I always highlight the more urgent issues. And I will work with the community pharmacy to find out if an interaction has already been addressed by that community pharmacist. Maybe they've already talked to the physician about it and the doctor is aware. So I work with the community pharmacist to ascertain if anything's been addressed already. And if not, I want to make sure that I'm communicating it to the physician. And then I also talk to the patient about what they need to talk to their doctor about. I think patient empowerment is really important these days. I think you kind of alluded to the patients are kind of left on their own to manage the medication issues, and the more armed they can be with information and what are important questions to ask their doctor about, the stronger and healthier they will be.
At what point are you typically introduced into the equation, and who normally introduces you into that equation? Because I'm sure people are not looking in the yellow pages, finding you, knowing even that your services exist. So help us understand how it is you get involved in the first place.
Sure. And I would say finding me is probably the hardest part unless someone has talked to somebody who knows about my services. I am on the website, the internet as much as I can be, but people aren't aware that there are specialized pharmacists like myself, and especially focusing in geriatrics, that can do these specialized reviews. So when am I pulled into the equation? Often it's later than I want to be pulled in. It's when someone already has a bunch of medications that the adult child is concerned that mom or dad's mental function is different. They're not as lucid as they used to be. They're forgetful. They seem a little confused. Maybe they've fallen. And these are all potential medication side effects, and it could be resulting from an interaction. So they would often, I have referral sources, depending on how the family is plugged into the community already. Maybe they're with a home health agency. Maybe they're working with one of the, Parkinson's Association or the Alzheimer's Association, for example, and someone will let them know about my services. But it's important to get the word out, to ask, to start asking questions about your medications, and hopefully at least get back to a pharmacist and possibly someone like myself.
Right. It's got to be difficult to coordinate all of this from a consumer's perspective, because you're seeing a variety of different doctors. And how do you make sure everybody's, I guess, interacting with one another and making sure that you're doing what's in your best interest? It's got to be confusing, and especially as we get older. I think we have to depend upon not only ourselves, but our support network to really help understand what the potentials are, and how doing something as simple as having our prescriptions and our medications in general reviewed to make sure that we're where we need to be makes all the sense in the world. So, we need to do a better job promoting what it is that you do, because it's an invaluable service. Do you ever find yourself going into skilled nursing facilities or other communities where you may have a little bit less of an opportunity to know exactly what's being prescribed and how things are being used?
I do go into nursing homes, and as an agent of the family, I can go. I see myself as an advocate for the patient and their families, because oftentimes people say to me, I've asked my doctor about my medications, and he said everything's fine. We don't need to change everything. All's good. So that recurrent theme of the doctor's really not paying attention to my concerns. So when I get involved for the family, I see myself as an advocate for their needs, because I'm a professional, I'm a geriatric specialist. I can speak the doctor's language to bring to the doctor's attention that this patient has concerns about medication. Often it's over medication or unnecessary drugs that should not be prescribed for older adults, or maybe beyond their value for that patient. So when I'm in a nursing home, I need to have access to the complete medicine list. So usually I did run into resistance one or two times. The nursing facilities sometimes are protective of the medication information, but as an agent of the patient, I've had no problem at least being with the family and able to access the medication list. But everything I do is really dependent on knowing all that a patient is taking and having that trust with the family and the patient, because I think they will tell me some things about their health or concerns about medicines that they may not tell their doctor about. So I'm able to round out the picture, if you will, by talking with the patient and the family members, regardless of where they reside, to help them work with their healthcare team.
Do all of your clients sign a HIPAA release that you're on so that you can actually have access to the records?
I have a consent form for all my clients, absolutely, yeah. Yes.
And the physicians and the pharmacies, I assume, accept that particular form that you have, and it's not met too much resistance?
Oh, absolutely not. And I've had some, whenever I've had occasional pharmacists even ask me for the proof of that release, that I can speak to another professional about the patient. And absolutely, there's no issues with that. And HIPAA is all about any exchange of patient-related information when we're involved in caring for the patient really is just professionally guarded information. It's that electronic transmission that I worry about. But absolutely, I want every patient's consent that I can speak to their doctor, share the report with the physician, and work with them in that nature. Yeah, absolutely.
Right. So tell us a little bit about the report. What does that consist of? How long is it? What does it address? And how do you use that if for some reason you're finding that things are not to your liking? For instance, I'm sure it can get kind of, I don't want to use the word combative, but there might be some concern having a conversation with the physician who thinks things are going just swimmingly, and you might not necessarily see it in the same way. So how do you have that interaction? How does that go?
Yeah. The report is, I want to be complete in what I do, but I also don't want to overwhelm the patient with too much information. So I do my best to break things down into smaller, manageable topics when I present my summary of the concerns that I see about a person's medications. The report is generally about 4 to 6 pages long. I mean, we have a cover page essentially. I have a one page that is their medication list. And to me, it's important that I give them a complete list of their meds based on what I talk to the patient about, but also a schedule so they can see a way to maybe simplify how they take their medicines. I always tell people the medications should not rule your life. You need to work the medications into what works for your life. So I try to help them simplify a regimen. And then I usually have 2 to 4 pages of a report summarizing the different concerns. I always word things in a very supportive manner, politically correct, if you will. I never want to confront the physician. We're all healthcare professionals doing the best we can with what we know. So I want to inform the patient and inform the doctor about medication concerns that the doctor may not have been aware about. So, and I always have references in my report at the end of my report. So for me, those are the important things I do professionally to make sure the physician sees that I'm basing my information on good evidence. I do have my geriatric certification, so I maintain my quality of knowledge. My continuing education is important to me to have my specialty certifications. And so generally I've not run into resistance with the physician accepting it. The doctor may not be so ready to make changes just then, but I know that they are considering the information and they might come back to it. It might be the next patient visit or the visit after that. But I generally don't run into a lot of resistance because I think most physicians know that they can't know it all. And this added perspective from a geriatric pharmacist is helpful, if nothing else, for them to consider.
How often do you run into compliance issues in regard to how we're taking our medications? And is that an ongoing issue that you find out there? And how do you help solve the problem of reminding folks as to when to take their medications?
The official current term is medication adherence. We always like to think adherence is a little bit more acceptable from both ends rather than compliance. You must take this medication, but same terms, compliance and adherence. It's a huge issue. We talk about 50% of older adults do not take their medicines in some way according to the directions they're supposed to take them. So that's one of the key problems I'm looking for, to find out how patients are taking their medicines and how can I make it easier for them to do that. So it's something I'm just strategizing with the patient. What's their current system? How is it not working? And how can we make it better? I'm a big fan of pill organizers. If we can use some of these easy assistance aids that are out there, make a calendar that you put on the refrigerator wall or wherever you keep your medicines. Sometimes it's a matter of checking off that you took certain medications. Those once a week medications can be problematic. So how can we, what's the schedule to help them remember to take a medicine on a certain day of the week? So adherence issues are important, but because there's so many different reasons why people don't take the medicines like they are supposed to, there are a lot of different ways to address it. So again, when I mentioned, sometimes the patients will tell me some things they don't tell their doctors. It's really important to find out, how are you really taking it? I'll ask a patient to tell me how you're taking this medicine here, metformin, whatever it is. And they'll say, well, I'm taking it twice a day, like it says on the bottle. I said, I know that's what it says on the bottle, but how are you really taking it? And then I'll find out, well, I tend to forget it in the afternoons because. So they'll start letting me know when they may not be taking the medicines exactly as they're supposed to. But hopefully by sharing that information with me, we can figure out why are you not, and then either I'll figure out a way to help them fix that problem.
Great. So if you could summarize for us in regard to going back to our original topic of interactions, what are some of the things that we personally, or if we are part of the support network for an older adult, what should we be looking for, or how do we know if there might be an increased risk that we're experiencing an issue with our medications?
If we remember that we are the most important person in the whole medication use process, it's that the patient who is taking the medicine every day that knows how they feel every day. And if you are the adult child, the caregiver of that person, you can see how mom or dad are reacting and responding. Maybe it could, like I mentioned, it could be a mental status change. They're a little more confused. They're a little more off. They seem more tired than usual. Maybe if you're checking a blood sugars regular or the blood pressure, you'll see a change in those parameters that you might be monitoring already. If something just doesn't seem the same, I always say we need to consider a medication as causing it. There's a famous quote I always put on any slides I give when I give presentations: suspect the medication until it's proven otherwise. And that's my big voice out there. I want to help people remember the medications are often the culprit, but a lot of people overlook the drugs. I've been taking them for all these years, no problem, but now something's different. So it could have been the person's health has changed. Maybe the kidney function or liver function or nutrition, their weight has shifted. So that could alter the way a medication is working. If a new medicine has been added or stopped, we don't think about how that might offset a drug interaction and cause a change in symptoms. So any new symptom, bring it to the attention of your pharmacist or the physician. Don't just let it go, because if it is a drug-related issue, you want to catch it early. And oftentimes, we may not see an interaction until we're looking at it after the fact, but catching it early matters. So I always say the person is the most important link on that healthcare chain. If you notice something's different with mom or dad, or if it's you are the patient yourself, bring it to somebody's attention. It could be the medication. Don't be complacent and just think everything's been fine, no issues. If something's different, as a pharmacist, I want to say we need to look at the drugs first.
Great. And that makes all the sense in the world. And I want to thank you very much for sharing with us today. Hedva, if somebody wanted to learn more, get in touch with you, I assume they can go to your website or give you a call. What's the best way for them to get a hold of you?
By phone, I'm in the St. Louis area, so it's 314-994-9409. Give me a call. I'm happy to explain more about what I do. And then my website has a lot of good information, and that would be www.HbL Pharm, as in pharmacy, PHARM.com. So it's HbLPharm.com. And you can also Google my name and it would come up, I'm sure. So.
Very good. Well, Hedva, thank you very much. I appreciate that. That was awesome. I want to thank all our listeners again for turning to this Senior Learning Institute educational moment. At the Senior Learning Institute, we strive to provide the straightforward and unbiased information you need to make smart decisions the first time. We're known for connecting older adults and their advocates to the resources they need to make educated decisions, from aging in place to selling the home in any condition, estate and financial planning, in-home care, estate sales, clean-out services, you name it, anywhere in the U.S. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, Certified Senior Advisor, Seniors Real Estate Specialist, and founder of the Senior Learning Institute.